Hi, this is Dr. Tim Dunne, and I'm with Advocate Integrative Medicine with Dr. Holly Dockery on our staff today. We've got a lot of emails that have come into the office saying, what is primary care? What does that look like? And am I a person or a patient that would benefit from your services on primary care? So this is the conversation that Dr. Holly and I are going to have. What is primary care?
So primary care is really all about health promotion and prevention. So you're looking at how can we promote health and wellness and how can we prevent disease. So typically with primary care, you're looking at doing annual physicals, typical screening tests, could be labs, could be health questionnaires, where we're looking for possible triggers that are going to be negatively impacting your disease. That way we can intervene and help prevent that.
So one of the things that we see a lot is we see our patients somewhat regular, meaning once a month, once every couple of months. That allows you and I to know their lifestyle a little better. And it sounds like that's something that by seeing them, we can benefit from that.
Absolutely. It's nice when you really get to develop a relationship with your client base, get to know somebody, get to know what their lifestyle is, what their health needs are. That can really point you in a direction as to what their health needs might be.
Right now, with all of our pandemic issues, folks, we're going to start talking a lot more about supplementation and about lifestyle changes that we can try and, as you had spoken of, head it off at the pass.
Yes, absolutely. The goal is that we can keep you healthy, keep you well, and that way you can live your life fully.
So what are some of the diagnostics that you may use to try and assess the patient to see where they're at?
So for a typical annual history and physical exam, we're going to be looking at your basic blood cell counts for any signs of anemia, infection, or nutritional deficiencies. Also going to be looking at renal function, electrolytes, and hydration. And that alone can tell you a lot. Depending on your age, we might look at some lipid, like cholesterols, and see how you're doing in that regard. That can tell us something about heart health. And also hemoglobin A1C, which would be an indicator of your glycemic control, which might tell us about your risk of diabetes.
Excellent. So we're doing blood tests.
Yes.
Are we doing urine tests at all for different reasons?
It depends on maybe what conditions you already have, and what your risk factors are.
And then we also may look at x-rays.
Absolutely.
Depending on what we deem necessary there. So it sounds to me like you're doing a lot of these diagnostics and then you're sitting down and you're painting a picture as far as what that diagnostic panel is telling you about the patient.
Right. You can take a look at the patient on the outside, which is really good information, but then with the blood testing and the diagnostics, you're getting a closer picture of what's going on the inside. And that way, from talking to your patient and putting all the information together, we can put it together and form a plan.
So this is something, folks, that you want to do on a regular basis or a semi-annual basis. So what always works for me is that on my birthday every year, is that's when you would make your appointment, come in and get your diagnostics and your labs and your checkup. Because everybody's birthday is different, it falls on different days, but it's unique to you as something you're always going to remember. So if we can come in and get blood work, blood panels, if urine analysis is necessary, x-rays, and then we as a team can formulate how to move forward and first change your lifestyle. And then from changing your lifestyle, hopefully we can head them off at the pass for more complicated issues.
Absolutely. And I think making sure, every year as we age, our health needs change automatically. Your health needs and wellness needs don't stay the same. As you age, with every year that passes, your needs are going to change. And so I think that's a great reminder that every year on your birthday, make an appointment and let's just follow up from there.
I love that piece. As you age, your health needs change and your wellness needs change. Critical point. Many times with us men, we're a little thick in the brow. So we think that whatever was good for me in my 30s, well, now I'm in my 50s, it's still good. And it changes every year.
It does. It does for everybody. Yeah.
Okay. So call us today, folks. Let's set up that appointment. Let's get this process started. So let's not view it as we're finding something that you know is there. Let's change that narrative. Let's have the narrative of health and wellness, and we're going to get you on a path so that you can live a life not in fear, but live a life of prosperity and thriving. That's what we do here at Advocate Integrative Medicine. Call us today, get an appointment with Dr. Holly, and let's start your journey.